This is a 40-year-old lady who presented with a giant aneurysm, in fact an ultra-giant aneurysm involving the left P2 segment of the PCA. You notice the PCOM as marked by the arrow here. This is a lateral view which again shows a partially thrombosed aneurysm. If you see, there's a large thrombus burden within the sac of the aneurysm and eccentric filling of the contrast. This is the 3D rotational angiography, and a directed run shows a choroidal artery arising from the P2 segment of the PCA. Because of the distortion of the anatomy, it appeared that this could potentially be a medial posterior choroidal than a lateral posterior choroidal artery. Every effort should be made to preserve this artery, and therefore we used a double microcatheter technique. The first coil is deployed from the initial catheter. Then the second coil is deployed from the second catheter. Once coil stability is achieved, the first coil is detached. We were able to achieve a focal occlusion with preservation of the origin of the choroidal artery. This is the initial run, and few minutes later there was complete occlusion of the PCA with preservation of the choroidal artery. We would like to discuss the importance of the medial and lateral posterior choroidal arteries. The medial posterior choroidal artery arises from the P1 segment of the PCA or the P2A segment, which is the anterior part of the P2 segment of PCA. It courses in the crural cistern, ambient cistern, and reaches the quadrantgerminal cistern. It ascends up to reach the roof of the third ventricle, and it progresses up to the foramen of Monro. The important supply for the medial posterior choroidal artery includes the cerebral peduncle and the medial geniculate body. It also supplies the tegmentum, colliculi, and thalamus. It rarely supplies the lateral geniculate body. Let's compare this with the lateral posterior choroidal artery. It generally originates from the P2 segment of PCA, the posterior part. It then enters the choroidal fissure and travels along the lateral ventricle to the foramen of Monro. The important supply for the lateral posterior choroidal artery includes the lateral geniculate body and the thalamus. In rare instances, it can supply the cerebral peduncle, medial geniculate body, and the tegmentum. Therefore, it is important to achieve focal occlusion of the PCA segment and preserve the choroidal artery to prevent any deficits. Thank you.